Hello, my name is Diana Munoz, and this is my video discussion. Today we will be discussing the function of the central nervous system. One major function of the central nervous system is controlling and coordinating our body's movements. The central nervous system is made up of the brain and the spinal cord. The central nervous system is the body's main communication and control system. One of the most important functions is receiving information from the body and processing that information. These signals allow us to perform movements such as walking, riding, speaking, and maintaining balance. Areas of the brain involved. The central nervous system controls movement throughout several areas of the brain. These areas include the motor cortex, the basal ganglia, and the cerebellum. The motor cortex helps create voluntary movements. The basal ganglia helps regulate and coordinate the movements created by the motor cortex, and the cerebellum helps with balance, accuracy, and smooth muscle control. Real-world clinical Parkinson's disease. Parkinson's disease is a neurological disorder that affects movement. The movement is affected because certain brain cells responsible for producing dopamine begin to deteriorate. Dopamine is a chemical messenger that helps basal ganglia communicate and regulate movement. If dopamine levels decrease, the brain has a difficult time controlling normal motor functions. A continuation of the Parkinson's slide. People affected by Parkinson's disease experience symptoms that include but are not limited to tremors, muscle stiffness, slowed movements, and difficulty with balance. With Parkinson's, someone who could previously walk, write, or do basic tasks have trouble performing daily tasks. This occurs because the central nervous system is no longer sending and controlling movement signals as effectively as before. Damage to the central nervous system. The area of the central nervous system that would be damaged is the basal ganglia, especially areas affected by dopamine loss like the substantia nigra. When the neurons are damaged, the basal ganglia cannot properly regulate movement signals between the brain and the muscles. These misfires can result in the physical symptoms that are commonly seen in Parkinson's disease. These symptoms include shaking, stiffness, and slow movements. Treatment for Parkinson's. A common medication used to treat Parkinson's is levodopa. The body uses the medication to convert to dopamine. This improves the communication between brain regions involved in movement and reduces symptoms of Parkinson's disease. Deep brain stimulation is another treatment option. This is done by placing a small device into your brain to regulate abnormal electrical signals. Physical therapy is also an important part of treatment. It helps patients maintain strength, balance, and independence. And then here is how the medication works. It goes into the dopamine receptors, and then dopamine is released. In conclusion, the central nervous system plays a major role in controlling movements. It processes information and sends signals throughout the body. Parkinson's disease demonstrates how damage to specific areas of the central nervous system can affect a person's ability to move and complete daily activities. Understanding the central nervous system and its functions helps healthcare workers develop treatments that improve quality of life for patients with neurological disorders. And thank you.